It's my feel-good breakfast show.
Welcome back. I hope wherever you find yourself in South Africa, in the world, that you're feeling all warm and cozy. Why? Because as the Starks of Westeros would say, winter is coming. But here, of course, in the real world, it doesn't mean that an army of zombies and ice beasts are on their way to destroy us, but rather an army of a different sort, far smaller, hordes of bacteria and viruses that want nothing more than to make us feel sick and miserable. I'm so sick at the moment. And there's nothing worse than being sick during winter, and it does make you miserable. We know about the mental effects, but there seems to be an evolution of the virus. We are asking our Dr. Darren Green this morning, when is it more than just a cough?
Exactly, Dr. Darren Green. Good morning. Welcome to the show.
Are you, buddy?
Are you well?
Good. Lovely. I'm
No
good.
coughing.
No, nothing yet.
You look fresh, you look healthy, yeah, man.
Let's just contextualize for a second.
Sure.
In a medical sense, what exactly defines a cough?
Yeah, it's basically when you collect a whole lot of air and propel that air from the chest cavity past the nasopharynx out of the mouth. And basically it's when you feel a sense of irritation anywhere in the airway. And the reflex of the body is to actually try and clear that irritation. And there are lots of different types of things that can obviously initiate a cough and cause that irritation.
And I've heard it happens at very high speeds as well. Body Bruce really wants to get it out there. So what's the difference between a dry and a wet cough? Because we have to dumb it down for ourselves. I mean, trying to explain it to our doctors. We're like,
100%.
It's a dry cough, no, it's a wet cough. What's the difference?
I think we need anatomy 101. So if you think of the airway, the main windpipe or the trachea, for example, it branches, the bronchus branches into two main branches, and then the tree gets finer and finer. So you've got the main bronchus, and then obviously you've got the bronchioles, which are the smaller parts of the tree. So depending on where the irritation is, the amount of mucus, where the inflammation is, and there we have a typical example of mucus forming inside, obviously, one of those bronchi. That then affects the quality of the sound as you move air and cough, whether the air moves through that mucus or not. And the crackling sound is actually of the mucus popping as it moves along these specialized respiratory airways. So you can imagine there's a massive difference between having infection in the peripheral part of the lung versus bronchitis, which is obviously in the main part of the lung.
And when you see the inflammation there, it really does come to bear.
That red, swollen, the inside lining of the pipe actually can constrict and become quite tight. And there are muscles as well in the bronchus. For asthma, for example, or bronchospasm, is when those muscles constrict and then the airway is narrowed, and then you get wheezing, which is the whistling sound that you get. That's the one?
Yes, that one. I've had that a few times. Okay, so our lines are open, 021-430-9881. I want to talk about home remedies and cough syrups. We hear different things all the time.
So many, yeah.
But what is the difference between them and which of them really work? All that and more coming up on our medical chat with Dr. Darren Green.
It's my feel-good breakfast show.
Yep, I think when it comes to being sick, I don't want to single out men here, but because we can be quite miserable. But I think generally most of us, you get a cough, you just kind of laugh it off. You ride the wave and get through it. When it persists, then it can become quite serious. Are we doing ourselves a disservice by not getting it sorted out right at the beginning, or can our bodies deal with it? How should we be approaching winter and that niggly little cough creeping in?
The cough tells you something. It's there as a protective reflex to tell you that something is irritating the airway. Whether that something is something as simple as having a bit of excess mucus, which occurs often in smokers, for example. It thickens the phlegm and the mucus. And then the little fine hairs on the surface epithelium of that skin that move the mucus along the airway struggle to do that because the mucus itself is thickened. If you're not consuming enough fluids, for example, the mucus can become quite thick. So the viscosities change and then it stays there. Children, when they cough, they often struggle to clear the cough. They don't know how to cough to propel phlegm. Some adults know too well how to propel phlegm and, to move that along. So the issue is, if you've been coughing for a long period of time, and by a long period of time, I mean a cough that is persistent more than 2 to 3 weeks, you should definitely have it looked at. And you might not have the other features of respiratory distress, which are important. Your breathing rate per minute, for example, is very important. Whether it hits 40 or more, you look at how many times someone breathes in and out. That's 1 per minute in 60 seconds. crucial to look at that, looking at your saturation, blue lips, blue peripheries for lack of oxygenation, and so forth. That associated with the systemic features of an illness, like fever, for example, are crucial. And that's when you'd obviously go and seek help rather rapidly.
Let's talk about those home remedies, because we were talking about it in the break that you mentioned, a little shot that you take as well.
Yes.
Home remedies, syrups, which of these actually work at the end of the day?
in the head?
Yeah.
Exactly.
There's just and the worse it tastes, the better people think it actually
Yeah,
works.
yeah.
Which is quite interesting. That's what Oma and Opa would say. Hey, so we find people using honey a lot in most preparations in terms of natural things. So they'll have a bit of rooibos tea and honey. Some people believe in having some lemon juice.
Honey and lemon together.
Yes, honey and lemon, because the honey is quite a soothing texture, and also coats the vocal cords for that hoarseness and that sore throat. And honey also has anti-inflammatory properties. For those that didn't know, they use it a lot in wound care. All the Cape Epic riders, when they have wounds, we often use Meloderm, which is a honey preparation as well. So interesting. So long of the short is understanding why you're taking something. Lemons, lemon juice, those are known to be a bit of a mucolytic. They break down the bonds between the thick mucus and slime. So that's why people like having lemon juice in their tea with honey. Some people add cayenne pepper for a bit of a burn because it opens up the nasal passages.
It helps the circulation.
I mean, you could snort wasabi too, I suppose. But that's not very
Instantly feel better or worse. Let's get technical here. We're talking about bronchitis, and then we talk about bronchiolitis. What is the difference there? And the one exhibits more in the case of children and infants, or is that
100%? You're right. So bronchitis, the main bronchus, and I mentioned the trachea, which is in the middle over there, and then your two main bronchi. So that's where the inflammation is. So you have swelling and excess mucus production in those big airways. That's called bronchitis, and that obviously can be brought about by infections, chemical irritants, etc., viral, bacteria, and so forth. Bronchiolitis, however, is in these small end branches of the lung tree. And in children, you find they come in wet and wheezy. So their cough sounds wet. When you listen to the chest, it's a little bit wheezy. And that then means that those small airways are going through a process of infection or inflammation.
Okay. Well, when we come back with a good doctor, I want to talk about bronchitis and how it differs from pneumonia symptomatically. All that more coming up on your Feel Good Breakfast Show. Oh, yeah, you can call us as well, just in case.
It's my Feel Good Breakfast Show.
Welcome back. Thank you so much for joining us this morning. Having a lot of fun with Dr. Darren Green. He's our resident doctor. And of course, we are broaching the new season. It's winter. Everyone's getting sick. Right now, we're talking about the difference between bronchitis. We've gone in depth there.
Yeah.
Now, pneumonia. Pneumonia enters onto the scene. What essentially is the difference and symptomatically as well?
People love using a double barrel to accentuate the illness. I've got double pneumonia. Have you heard that?
Yeah.
So
Triple and you did.
That normally implies two lobes of the lung. So pneumonia, unlike bronchitis, which affects the main bronchus, the big pipes, affects the alveolar sacs. Yeah. So the sacs are those pockets, those specialized sacs or lung cells that occur at the end of the bronchial tree. And what they actually, what happens in pneumonia is the bacteria or the infection obviously causes a lot of a consolidation, solid inflammation, and then a collection of the bacteria itself with all the inflammatory responses in the lung, affecting that lung tissue that it can't exchange oxygen anymore at that part of the lung in those specialized air sacs. And that then leads to you being short of breath. That also causes the systemic effects of a fever, etc. And you can obviously then have a pleural reaction, which is the cling wrap membrane around the lung, which becomes inflamed, and you get sharp stabbing pain when you breathe in deeply. Sure. So
I'm going to judge you. If you've got pneumonia right now, I ain't judging you anymore. That sounds pretty serious.
You feel tired and weak, you know. You really do.
We've actually got a call on the line. Niren from Durban. Good morning, Niren. What is your question or comment for the doctor?
Yes, ma'am. I just wanted to know if you're a diabetic, is it advisable to use honey?
Okay, that's a pretty good question,
good
Darren.
question.
Thank you so much.
So you get different types of honey. You get raw, unfiltered, unprocessed honey, which pregnant ladies shouldn't get because there's association with certain bacteria, for example, in unpasteurized or radiated honey. Yeah. So have a look at that. But certainly when you're equating honey and sugar, be very careful because the exact, in terms of calorie intake and the ability to raise your blood sugar level is exactly the same.
It is sugar.
We do advise diabetics to use sugar-free expectorants or mucolytics. So you'll find a cough mixture has two things in it, a mucolytic, which breaks down slime.
Yeah.
So there's some chemical drugs in there that do that. And you have a bronchodilator, which works on the muscle of that main airway to relax it, so that it opens it up. But ask for a sugar-free preparation, specifically if you're diabetic and obviously on
So,
medication.
Naren, the short answer is you should avoid the honey. Yeah.
Well, thank you so much, Niran. I want to know from you is we were talking about a persisting cough. When should you be worried that this might be TB?
Yeah.
What are the telltale signs that this is now something really extreme?
When should you go for an X-ray?
Yeah.
Yeah, true.
100%. So the big features of TB are chronic cough. In other words, you're coughing for longer than 4 to 6 weeks.
Okay.
You have night sweats, so you perspire a lot at nighttime, funny
Yeah.
enough. You have loss of weight, and then obviously you have a chronic wet productive cough, and sometimes you even have blood-speckled sputums or what we call hemoptysis. So those are big. You might also have, depending on the stage of the disease, lymph nodes that are enlarged, and also your age. It might present differently in children as it does in adults. Remember also that TB doesn't only affect the lung. You get forms of TB that affect the entire body, the nervous system, the liver. That's called miliary TB, for example.
Yeah.
So people need to be aware of that. So we live in the Western Cape. Everyone's been exposed to TB in some or other way, and there are ways, obviously, of testing it with a simple blood test. So if you have a chronic cough that doesn't go away and you have productive cough, for example, after 4 weeks, have it checked out, and then they could do those sputum tests on your sputum.
I've seen an X-ray of someone suffering from TB, and it's terrifying.
With the cavitations
Absolutely
and the
terrifying.
holes
We'd
in the
love to hear from you. 021-430-9881. If you've got any comments or questions, when is a cough more than a cough? We'll join the conversation again after the news.
It's my feel-good breakfast show.
Back with our chat with Dr. Darren Green. We just love these moments where we can just kind of, connect on such a deep level as well. Let's talk about lung and throat infection. Now, when does it affect smokers? And why do so many smokers continue smoking throughout this really dire situation?
Congratulating Steve, one of our cameramen, who has now not smoked in 2 months, which is brilliant, dude. Well done, man.
Amazing.
I mean, no one should be smoking at any stage, but is it right to smoke when you're sick, or where?
You'll find people that actually have a lung infection find they need to nebulize by smoking. They swear it helps them while they're sick. Regular smokers,
down, yeah.
because they're obviously feeling quite tight in terms of the chest. And just remember, when you inhale cold air, it worsens the bronchospasm, and the hyperreactive airways induce coughing. So if you have an irritated bronchus and an early bronchitis, and you walk past the fridges in a supermarket, you're going to start coughing. Sometimes you even start talking. As you get to the end of your sentence, you start coughing.
Yeah.
That's a hyperreactive airway. So smokers certainly are more prone to throat irritations. They're more prone to oral ulcers and mouth sores. And then obviously the effects in the lung itself on those hair cells that I mentioned that move the mucus along. Smoking affects that, and so does it the viscosity of the mucus in the lung.
We've also got Nazreen on the line. Nazreen, good morning. What is your question or comment for Dr. Darren Green?
Hi, good morning.
Morning.
Hi, I'd like to find out, I have a 3.5-year-old son, and he suffers a lot with phlegm. He's always getting a lot of phlegm. Now, he's had a bad cough, and after a week, it seemed like it was going away, and then it suddenly came back again, and it's been persisting for another 2 weeks or so. It's quite phlegmy, and it's been affecting him. He can't seem to eat or drink anything, and it's making him throw up all of his food. How do I get him to get rid of the phlegm? And do I need to take him to a doctor now, or can I just continue with cough meds or home remedies?
Great question.
It is a
thank you,
great
Nazreen.
question.
So
You don't
many
want
parents.
to leap to, I hate jumping to medication all
And
the time. or
X-rays,
something like that.
etc.
Yeah.
prematurely. So in this case, you've got a 3.5-year-old with a persistent cough for about 10 days or more. It's wet and it's wheezy. Number one diagnosis, as we said, there's bronchiolitis, but obviously one would need to examine the child. Remember the important things for moms and dads to know. When do I take my child to the hospital?
Yeah.
Look for those 4 things. Look at what's the rate? How often is your child breathing in and out in a minute? What's the rate? If it's close to 40, get your child to the hospital.
Yeah.
Look if they're swinging fevers and temperatures and your child's not ingesting, eating or drinking properly. Look also at the chest while they're breathing, whether there's a recession, subcostal recession under the margin of the ribs.
Yeah.
If it's sucking in like a bucket handle, you need to get to the hospital. And look at the nose. If these nostrils flare with every breath, you know that there could be, obviously, hypoxia or shortage of oxygen being exchanged as a result of a disease process in the lung. Those are features of respiratory distress, and that's when a parent should take the child to the hospital to be examined and then obviously get an x-ray.
And Nazreen, I think by virtue of the fact that you phoned in and something in your gut is saying that maybe you need to do this, then do that for your own peace of mind. I know we don't love to jump to medication as a first resort, but especially when dealing with a young child, I think always be safe and have him checked up. We wish him a very speedy recovery.
Indeed.
Dude, thank you so much. This chat has terrified me. I wish it made me feel more comfortable about winter, but I think the most important thing is keep yourself healthy, and there are so many healthy, natural ways that we can boost our immune system, clear the airwaves, and keep ourselves healthy. So do that before it progresses too far.